So let's talk about heart valves and blood flow. It's important that you understand what's going on when the blood is flowing through the heart, what valves are being opened and closed, and what is going on. Because in the future, as you start to learn, you're going to learn about congestive heart failure, and understanding this is going to help with that, hypertension, all of these other things that happen, acute myocardial infarctions, and this is going to help you understand and move you forward as you learn and get involved with patients or clients that have different disease processes. So let's take a look at this picture. This is a picture of the heart. We know the heart has four chambers: the right atrium, right ventricle, left ventricle. And with the heart, physically looking at it, we have four valves. We have the tricuspid valve, the pulmonary, mitral, and aortic valve. These valves are so important on how they function. The muscle, the physical part of the heart is a muscle, smooth muscle. We need it to function properly so that we can perfuse the body with oxygenated blood and keep tissue alive. So, blood flow through the heart. First of all, blood comes from the body and into the right atrium. This is unoxygenated blood. It needs to go to the lungs and make that or have that gas exchange where CO2 gets pushed off and O2 gets put on so that we can then bring that blood back and oxygenate the body. It will enter through the tricuspid valve into the right ventricle. So we go from the right atrium through the tricuspid valve into the right ventricle. So then the right ventricle is going to squeeze the blood through the pulmonic valve into the lungs. If you think lungs and pulmonary, it kind of makes sense that the pulmonic valve will be the valve that's going to open up and allow blood to go into the lungs. This is actually where that gas exchange will take place. The oxygen goes into the lungs. It's going to push off all the CO2 and allow O2 to attach to the hemoglobin in the blood. So we're oxygenating the blood at this point in the lungs. Then the blood's going to enter back into the heart, into the left atrium. It will then enter into the left atrium. It's sitting there with oxygenated blood, and it wants to go through the mitral valve into the left ventricle. So we're into the right atrium, through the tricuspid, into the right ventricle, up through the pulmonic. Let's get oxygen. Let's come back into the left atrium, and now we're being pushed through the mitral valve into the left ventricle. So there's a couple things that I want to point out about the left ventricle. First of all, also the mitral valve. Mitral valve is probably one of the strongest valves there, that and the aortic. We're looking at two really used that need to do a lot of work along with the ventricle and the left side of the heart. So remember that the left ventricle is the strongest part of the heart. It has the thickest part of the muscle. It is where the PMI, the point of maximal impulse is. It's also known as an apex beat. And this is where we're going to listen for our apical pulse. So if you think about muscles, if you're really muscular and have big muscles, you're usually really strong, right? Because that's how muscles work. You break them down and build more muscle tissue, and it just gets stronger and stronger. Well, that's what's happening with the left ventricle of the heart. It is the heart, part of the heart that has to squeeze really hard because it's got to push all the blood up and out so that we can oxygenate the body. And saying that, we then understand it's the thickest part. It's where we hear our apical pulse. It's the strongest. It's the point of maximal impulse. That is there happening in that left ventricle. Mitral valve, you'll hear a lot about people having to have mitral valve replacements. And the reason why is it is a very used valve. It's going to be used, it comes through, it's blood flowing down into the ventricle. Then what happens from that left ventricle, it's squeezing hard. And note I put the hard in all capitals. It's pushing blood through now that aortic valve. Now, the aortic valve is a biggie. We've got to have a good aortic valve because it's got to open efficiently and close efficiently. When we push through, it's where the blood is coming out up through that valve and out into the body. Just so you know, 20% of the blood that goes out, that gets pushed out at this point, is going to perfuse the brain, and then the rest of the 80% is going to go to the rest of the body to oxygenate the body. Of course, you need to understand that when we're perfusing, we're going to send oxygenated blood to the major organs. We want to keep our bodies alive. So major organs will get the oxygenated blood first, or in those areas, to make sure that they're getting what's needed to keep tissue alive. And then the rest of that oxygenated blood is going to go on down and throughout the body. And this is how the flow of blood works throughout the heart. Now, I saw this and I just thought this is a perfect way to remember this. And so it's toilet paper my beep arse. And as you can see, I have a picture of a donkey here representing that last aortic valve. So it is tricuspid, pulmonic, mitral, and aortic. And I just think that's the greatest way because who's going to forget that? TPMA. I hope this helps.